there are some days you like better, and there are some days when you feel more proud of your government than others, and today is one of these days, because I'm here on behalf of my government, the government of Sweden, and through our development agency, SIDA, to enter into an agreement to contribute to the Health Development Fund. And the contribution stated in this agreement that we are signing today will support Zimbabwe's ongoing efforts to further reduce maternal and child mortality, and will contribute to improved access to sexual reproductive health and rights services, especially for young people. As Jane was saying here, this is a coordinated effort by the government of Zimbabwe, by the United Nations, and by bilateral partners, including Sweden. We have been helping in the field of health for quite a number of years, but I think that with this agreement, where we become directly part of the Health Development Fund, it's also a sign of our further re-engagement with Zimbabwe, which has been going on for some time. Before my speech will go into some technical details as to what we expect and the like, but before that, let me just say that and to remind ourselves why we have this fund. And I'll just pinpoint to one thing, and that is the pressing challenge of bringing down the number of women and girls who die as they're giving birth to new life. And true, thanks to the hard work by the Health and Transition Fund and the Integrated Support Program and committed partners at all levels, the maternal mortality rate in Zimbabwe has gone down over the past 5 years. But there is still some way, and substantial way, to go before the level is down to what could possibly be an accepted level. High mortality rates among mothers and newborns are not an inevitable fact of life. It can be addressed, and we know how. It is a matter of resolve and commitment. And the right to life is of course perhaps the most fundamental part of our values and norms, and it's a key article in human rights laws as well. And this imperative comes of course with particular significance when mothers are delivering new life, babies, into this world. We know that maternal mortality rate often is closely related to gender inequality and to other rights pertaining to women and girls that are not fulfilled. Access to basic health services is a necessary first to ensure low maternal and child mortality. Yes, we are entering into agreement of 199 million. I don't know why we didn't make it up to 200, but maybe it's excluding VAT. No. But this agreement we are signing is for 199 million Swedish kronor, and which roughly corresponds to $24 million over the next 4 years. And this agreement and contribution is in line with Sweden's government priorities globally when it comes to our development cooperation, and in Zimbabwe as well. And that is providing support to basic health care, strengthening of health systems, and in improving access to reproductive health and rights services. The previous Health Transition Fund, to which Sweden was a major but indirect contributor, managed to avert what at that time was a rising rates of maternal and child mortality in Zimbabwe. But that has now, fortunately, we now see a more positive trend. And this new trend is something that we need to build on. The new Health Development Fund will therefore work to sustain and build on these positive gains, and to continue to invest in providing health care of good quality. We are pleased that the new Health Development Fund will have a strong focus on inclusiveness and equity, ensuring that health services reach out to remote areas and made accessible to the most vulnerable groups in society. Let me also reiterate that Sweden welcomes the integrated approach in the Health Development Fund and applauds the increased focus and planned work on sexual reproductive health and rights, especially for the young people. This is a key priority for my own government, and it is without doubts even more crucial in a country like Zimbabwe, which has such a large, young and health-wise potentially vulnerable population. We hope and believe that our contribution to the HDF, the fund, will do its share to tackle these issues like teenage pregnancies, child marriages, gender-based violence, HIV prevention, and young people's access to sexual reproductive health and rights, and also to work towards improved gender equality and to the fulfillment of women's and girls' rights in the health system as a whole. While funding demanding humanitarian crisis and a new health development fund that is currently not fully funded will inevitably put pressure on all of us on how to make these priorities. It will inevitably force us and the implementing partners to make hard priorities and communicate them well. And this has already started with the budget for the health workers' retention allowances. We look forward to learn more on the results of the costing of the National Health Strategy, the health financing policy, on the fiscal space analysis, and assessment of results-based financing and human resources for health. Those are important steps towards necessary health reforms, better government and financial sustainability. Now someone has comments here. With the current economic difficulties, we need to be even more alert and work very closely together to ensure that our impact remains high. We expect the greatest transparency from the government and from the United Nations agencies. Now when a humanitarian crisis and a limited funding has made the health development funding more financially vulnerable. The agreement we are signing today is part of a collective commitment by the government of Zimbabwe, UNICEF, UNFPA and Sweden to provide healthcare services of good quality to women, children and young people. It will rely on the commitment and hard work by nurses, doctors and providers of health equipment. Collaboration and coordination is crucial. And my government would like to encourage the government of Zimbabwe and the United Nations agencies and other development partners to engage in this collaborative and coordinated effort and to work out strategies for reaching a future sustainable health system with increased government funding. So let me conclude. Sweden is very proud to be able to contribute to this towards better health and well-being of women, girls, boys and young people in Zimbabwe. We are proud to help to pave the way for a future sustainable health system in the country, where everyone has access to basic health services and of good quality. So we are looking forward to a fruitful collaboration. Thank you. Siyabonga Tatana.
Nicest things to do, to come and represent the government at such an important occasion, where you are really recognizing and receiving very kind support from Sweden. And I think really it's something that we cherish, we really appreciate this, and especially because it's coming to the health sector. It's coming to the government of Zimbabwe, but into the health sector, a very important sector, which is often not reflected in the priority financing that is done. We prefer that health be put as number one, and not in terms of just quantum, but in terms of percentage quantum. And we want to push all the time that 15% of the national budget comes to health. This is what was declared in Abuja, and we continue to push for that. So that when we sign with Sweden for 199 Swedish kronas, I think that we then say, yes, we're putting also so much, and you are putting that much. 24, this is about 24 million US, you said. This is really, and this is just for 2016 to 2020. And the first disbursement for 2016 is 49 million Swedish kronas. And this is going to be channeled, like you rightly said, through the Health Development Fund. And this special vehicle is welcome. It's a good platform for all players to come in. But I would like you just to give them a round of applause. I know that last year in October, we were in Mausewa with the EU ambassador, and we launched the Health Development Fund. At that time, we had no idea where we were confident that we would get support, but there was no money at that time. So it was signed in Mausewa at this new hospital, and we then expected monies to start coming in. And then in February, I was with UNICEF, Reza, and the EU ambassador in Chinoi, and they signed for euros 42.9 million to be used for the next 4 years. This is really how it all started. Now, EU is doing well, and the EU, according to this now, the EU included and then they were also assisted by Gavi, UNICEF, DFID, UNFPA, to contribute to that amount of money that I've just said. But EU now, Ambassador, you Britain have voted, they voted to exit. So, yeah, I'm asking you because you are a strong member that they've voted to exit, but I think that with that exit, it still will not affect, I hope. No. I hope. Yes, thank you. We just wanted that reassurance from the ambassador. We are hoping that we sustain the gains that we've made from the ISP. There was the ISP at first, then after that there was the Health Transition Fund. And these programs that have been going on through these particular platforms have yielded very good results, working together with the ministry and government. So when EU and others put money, they then work with the government, with the Ministry of Health, Ministry of Health officials to strategize, to plan, to use the buildings, to use the... So it's all efforts together. And they have yielded very, very, very good results. And if you look at the small piece of paper that you were given today, this one, if you look at the last page, you can see the results there. Very good results of how indicators have shifted. Maternal mortality ratio was 960, and it's now, but this is 2014, it's now 614. I'm sure by now it's gone further down. It's much further down now. The figures are already pointing in the 400s. So I think we're pleased with that. If you look at the neonatal mortality rate, all those indicators have improved because of finding the collaborative effort, because of the platforms that we share. And these are the achievements that should always be mentioned to just point out how important it is to work together. And if you look at the page before that, where there are the thematic areas which Jamie has already talked about, I see why I just wanted this page is the importance of motherhood. And you can see the lady in the picture there who is pregnant, and the nurse, they are really enjoying themselves there. So I think these are things that we should all applaud, that we are looking at reproductive health, we are looking at deliveries of women, we are looking at the 3 delays, why maternal mortality rate is high and how it could be lowered. And I think it's an important area, very important area. And I'm glad you put it down there as one of our thematic areas, including the issue of human resources. And this is an area which, as you know, has to be addressed very, very transparently, in a very transparent manner. Among others, all the thematic areas must be transparent, but that particular one must improve on what was in the Health Transition Fund.
Go ahead. Yes.
Right.